please click like to help Be Green with Amy. Welcome, Dr. Peter Rogers.
Greetings, Green Warrior, and welcome back, Dr. Rogers. Well, Green Warrior, do you know how to protect your kidneys and prevent kidney failure? Today, Dr. Rogers will share life-saving insights on kidney health, including how to prevent kidney stones and avoid the risk of kidney failure. So we're going to start off with our game of true or false.
It's time for True or False on Be Green with Amy Live. Answer true or false to Amy's questions in the comments below, and Amy will ask our guest for the expert answer.
Okay, here is a true or false. Green Warriors, tell me what you think. True or false? Dehydration is a common cause of kidney stones. Type in your guess, Dr. Rogers.
Yeah, what they say is the solution to pollution is dilution. And basically, the drier your kidneys, the more likely the calcium that gets excreted in the urine is going to precipitate.
Okay, well, that's good to know. And we're going to talk more about that a little bit later on in your presentation. Okay, Green Warrior, here's our next question. True or false? Kidney failure only affects older adults. Dr. Rogers?
It can happen at any age, but it's much, much more common as people get older. People tend to be losing kidney function continually, and it starts becoming more significant typically in their late 50s, early 60s. I see mild kidney failure all day long every day. And I see a lot of advanced kidney failure too every day. It's very common.
Yeah. But not necessarily an inevitable consequence of aging.
Oh no, most of it's, for the same things that make people, fat, sick, and stupid. It also destroys their kidneys. The Western diet.
So Green Warrior, here's our next one. True or false? Salt intake has no impact on kidney health. Dr. Rogers.
Yeah, I think of potassium as usually being the good electrolyte, and magnesium. They're the good guys. M for magnesium, M for mellows you out. They're the ones that keep arteries open, whereas sodium, when people say salt, they usually mean sodium chloride. Sodium's sort of the bad guy, if you will. It's a vasoconstrictor. We tend to get far too much of it. It's abundant in processed food. It's used all the time on meat to flavor it and to preserve it. So most people are eating way too much sodium. And the chloride is also a little bit bad too. The excessive amounts of chloride we get, plus it's in the unfiltered municipal tap water, it displaces bicarbonate in the blood. They're both anions, negatively charged ions. And it has a tendency to promote a low-grade metabolic acidosis. So it's not good.
Okay,
it also activates platelets, so it has a little bit of a prothrombotic effect.
All right, now final true or false question. True or false? Chronic high blood pressure can lead to kidney failure. Green Warrior, what do you think? Dr. Rogers?
Oh yeah, it's super common. Blacks have a lot of hypertension. When I was an imaging guided surgeon, I used to do declots, so open up the arm dialysis grafts, dialysis fistulas. I can tell you, just walk in any dialysis unit, you'll see a whole bunch of black men from hypertension and kidney failure. It's a common cause of kidney failure.
All right. Well, these are very interesting facts that you're sharing with us. And we have a lot of good answers from our Green Warriors. They're right on board here. They're ready to learn some more. So would you like to begin your presentation?
Oh, yeah. I got a lot of slides.
Okay.
I think they're good. I think it's interesting stuff.
Okay. I know it will be.
Okay. You ready? Can you see it?
Yes, we can.
Okay. So here's the kidney. Here is the ureter. It is the tube that connects the kidney to the urinary bladder. The little arrow is the jet. A jet of contrast squirts into the urinary bladder. And then here's a urethra that we excrete our urine when we void. Here's just a little bit of pathology, get a sense of what's going on. The red circle here is a kidney stone that can obstruct the ureter, typically right here at the junction of the renal pelvis and the ureter. So that's a ureteropelvic junction. You can also get stones. A common spot for them to lodge is right at the urinary bladder. And that's called, the bladder is called the vesicle also. So this would be the ureterovesical junction. When we do an ultrasound, we're always looking for this jet. You can see the jets on color Doppler, that detects motion. So a jet of urine squirting into the bladder helps you to know that urine is able to flow through the ureter. It's not blocked by a stone. I also drew a bladder cancer in here just to show you another common cause of urinary tract obstruction. Relatively rare. I'll sometimes see a bunch of enlarged lymph nodes encircling the ureter and blocking it, like in a lymphoma. Testicular cancer will do that. Sometimes prostate cancer will do that. You can also get a prostate cancer growing up and blocking the ureter, and then you get back pressure obstruction of the kidney on one side. These are just common causes of kidney obstruction, but the most common problem is just a problem with blood flow to the kidney in terms of causing kidney failure. So let me get back to my presentation here. Okay, here's a little bit more detailed anatomy. So the artery comes into the kidney, and then it passes up into this is called the cortex of the kidney. Cortex means bark, like the bark of a tree. Like you chop a tree down, you see the rings around the periphery. So you see the renal cortex in the periphery. These triangular structures here are the renal medulla, and that's where urine is most concentrated. So it goes up into the cortex, and it's filtered through what's called Bowman's capsule into the urinary space. This is called the glomerulus. And basically, there's the entering artery, brings the blood in. It's pushed out into the glomerular space, the urinary space. This will be called the primary urine. The blood that doesn't get filtered out exits through the efferent arteriole, it's called. And then these tubules here, the proximal tubule, loop of Henle, distal tubule, this is where all the concentration reactions are happening. And basically, the whole goal of the kidney is to filter the blood. The most important thing it does is remove the nitrogen, because people eat too much protein, so there's a lot of nitrogen has to be excreted into the urine. Makes urea, makes urine. It also manages the other solutes, how much sodium do we reabsorb, same thing, with all the other solutes, the potassium, the calcium, the phosphorus, the magnesium, everything. The kidney is in charge of everything. Okay, here's a strainer. This is also called a colander. And part of the mechanism by which the glomerulus filters the blood is through size. Big proteins are not going to go into the urine. Same thing with a cell, but tiny little proteins can go in there. Usually, let's say, albumin's about 69 kilodaltons. That's too big to normally go into the urine, but it's still a relatively small protein. So when the kidney is defective and you have an abnormal barrier, you'll be filtering albumin, your most common blood protein, into the urine. You don't want that. Okay, what does the kidney do? Like I said, it filters nitrogen out of the blood, sends it into the urine. It's a waste product. Removes other waste products like creatinine. It activates vitamin D to its active form, which is important, so you'll absorb calcium normally in the gut. It increases your hematocrit. It has a chemical called erythropoietin. That's the one the bicycle riders in the Tour de France were taking to get their hematocrits up higher, the amount of red cells in the blood, so they'd have more energy for long-distance races. The problem is if you're just sitting around with a high hematocrit, your blood's full of cells, not enough fluid, it can precipitate and get a myocardial infarction. A significant number of these young guys died because of that. They're getting their hematocrits up over 50. Excrete toxins. Other toxic things in the blood are often solubilized and excreted out the kidneys. The liver sort of is what tends to primarily detox chemicals in the blood. And it's like the immune system for detoxification of chemicals. And then they're quite often made more soluble and excreted either in the bile that exits the body by defecation, or they excrete it out of the kidney. Regulates blood volume, which also regulates blood pressure. In part, it does that by regulating the electrolytes, things like sodium, potassium, magnesium, calcium. Bicarbonate is a base buffer to help prevent the blood from becoming too acidic. You need to have a good acid-base pH, in the ballpark of 7.4, because all your chemical reactions are affected by that. So the kidney regulates acid-base in a big way. It can excrete the protons, which is the acid, H+. It can reabsorb bicarbonate, the base, to neutralize the acid. In general, an acid is something that donates a proton, H+, hydrogen ion, okay? In general, a base is something that can accept a hydrogen proton. It makes ammonia also, because that has a base effect, and it can be helpful in the short run to handle an acid load. But if a person's chronically acidotic, which is most often due to eating animal protein, in the long run, making too much of this ammonia will damage the kidney. The kidney is very important for overall health. When the kidney starts fading out of its function, the blood becomes more prothrombotic. And most patients never make it to dialysis. They die before that from coronary artery disease, a heart attack. Okay, it's kind of like diabetes. The most common reason a diabetic dies is from a heart attack. So in a sense, kidney failure and diabetes funnel the patient towards a heart attack. Okay. Now, just a little bit of chemistry. Here's an ammonia. It's NH3, nitrogen with 3 hydrogens. You can add a hydrogen on there, and then it becomes ammonium INH plus. Ammonia is toxic to the body, so the liver solubilizes it, converts it into what's called urea. So here's a carbon, here's an oxygen, and then the urea travels through the blood and goes to the kidney to be excreted in your urine. You can measure this in the blood by something called BUN, blood urea nitrogen. The blood urea nitrogen is an indicator of how well your kidneys are functioning. It's also an indicator of how much protein you eat. If you get some of these crazy young bodybuilders that are taking all these protein shakes, eating a high protein diet, they can sometimes get their BUN up and almost a bit of a false positive in the sense that it's artificially elevated because of their excessive protein intake. In the long run, that's a stupid idea. Lots of protein powders are contaminated by heavy metals, and they're nephrotoxic, not to mention the nephrotoxicity associated with just eating such a high protein diet. Okay, some lab tests for kidney function. We just briefly talked a little bit about blood urea nitrogen. In general, you want it to be 24 or less, okay? If you're dehydrated, it'll look worse. And you can make your labs look better by drinking fluid before the labs to dilute things. But, you want to standardize things across. If you're being fouled up, how you do it the same each time so you get reliable comparisons. Glomerular filtration rate is by far the most common thing we go by. We look at this on every single patient. Every single patient before I do a procedure, I look at their GFR, make sure it's reasonably normal. Everybody before they get injected with iodinated contrast for a CAT scan or for an MRI with gadolinium contrast, we always want to check their GFR. Normal is about 100, 120 even. And you're actually still going to function well if you're above 60. When you get below 60, that's when you're considered to have a disease. You got CKD, chronic kidney disease. Okay, so that's the amount of milliliters sort of filtered per minute, glomerular filtration rate. So the glomerulus is the filter in the kidney. It's the key unit of the nephron, the filtering device in the kidney. And that's mostly what you go by. So what you look at is that you look at the GFR trend. If the GFR is trending down, that's worrisome, that the patient's, getting into serious trouble. Another thing I really like about GFR is you can correlate it to the number of nephrons the patient has in their kidneys. So, at optimal function, they're going to have about 1 million nephrons. When they drop to about 60, which is very common for people in their 50s and 60s, they're going to have about 600,000 nephrons. When they drop to GFR of 30, then they're usually only going to have about 30% of their original amount of kidney function and 300,000 nephrons. And this is where they start getting really scared, because once somebody drops to a GFR of 30, it starts looking, almost inevitable they're going to end up in kidney failure on dialysis or die first of a heart attack. So this is when people freak out and they start wanting to really learn something if they've got a brain in their head. And there's a lot of things you can do to slow down the rate of kidney decline. We're going to talk about those. But like I said, this is where, the S hits the fan and people really, if they got a brain in their head, they freak out and they do everything they can to save themselves from being in dialysis. Dialysis chair is a bummer. It's, 3 days a week, 5 hours at a time. Okay. The only chair worse than dialysis chair is the electric chair. Okay. Creatinine in the blood, it's a waste product of skeletal muscle. And usually it'll be pretty standardized and it's excreted by the kidneys in a relatively steady state. There's always more detail, like some tubular secretion, but in general, it's still a pretty useful test. For a long time, for many years, we used to go by creatinine level in the blood rather than GFR, but GFR is the more useful. Somebody's a big, heavy muscular weightlifter, they can be a little higher in their creatinine levels. Okay, and the goal of treatment, let's say when you say somebody's got kidney disease, what you mean is their GFR is decreasing and you're afraid they're going to end up on dialysis. So the goal of treatment is how to maintain their GFR at what it is or even improve it. Okay, and again, it's an indicator too of their ability to excrete the nitrogen in their blood. So if you reduce your protein intake, you can help slow down the decline in GFR. Dialysis didn't even become common until after 1972 when Medicare agreed to pay for it. And then it started becoming common. Before that, they had to treat everything by dialysis. And they actually used to know more about handling it by diet than they know now. Most doctors don't know anything about this. It's kind of pathetic, but they don't. Okay. All right, here's the stages of kidney function. So like I said, stage 2 is when you get, you're still okay because you're over 60. Stage 3 is where you're described as formerly having a disease. So this would be chronic kidney dysfunction. You're 30 to 60, okay? Stage 4 is like when, like I said, when they freak out, and you get 30 and below, because you're headed towards, usually dialysis is when their GFR gets down to about 5 or 10. Then they have to go on that. And so that would be like stage 5D is in dialysis. Not good. Okay, this is another indicator that, if you're starting out with 100, 120, as much as that, you can still have pretty good kidney function if you donate a kidney, because you'll have, let's say you'll have a GFR around 50 to 60. So you can still be in pretty good shape, but man, you better take good care of your kidney if you only got one. Okay, here's something called a heat map. And what this is all about is that you got your stages 1 through 5, like we just talked about with regard to the GFR, but you've also have a concept of albuminuria. Albumin is the most common protein in the blood, and you start losing that in the kidney quite often with kidney dysfunction. The more albumin protein you're losing in the blood, usually they just call it proteinuria, the more rapidly your GFR is likely to continue to decline. So here's a patient who has not that bad of a GFR, let's say 45 to 59, but because they're having lots of proteinuria, so this is mild, moderate, and severe proteinuria, they're at very high risk to rapidly end up on dialysis. So both factors are important, the current GFR as well as whether or not they've got proteinuria. Like I said, proteinuria is a poor prognostic sign. And so what causes increased proteinuria? Dietary saturated fat is a big thing. Also increased intake of dietary protein, especially animal protein. And it can lead to fibrosis of the nephrons, the glomerulus, and just basically destroy the kidney. Okay, some of the risk factors, of course, aging. And kidney failure can be a little scary. It can be quite asymptomatic until late. So that's why, once every 5 or 10 years, get your kidney function checked just to make sure you're not trending down, okay? And kidney failure is not as glamorous as breast cancer or heart disease, so most people don't know anything about it. High-fat diet, the meat and the fat are just a disaster for the kidneys. And, it's the typical patients that funnel people towards all this stuff. They get fat from the standard American diet or the high-fat and meat diets. The obesity is associated with hypertension, and it's associated with diabetes, and they funnel the patient into atherosclerosis. You start plugging up the arteries in the kidney, and the kidney doesn't function so well. This lady's she's a good dietitian she specializes in kidney, this Jennifer Moore lady. I didn't read her book, but I've seen her lectures. She's good. Congestive heart failure, kidney stones, smoking, IV drug abuse. IV drug addicts routinely end up in kidney failure. They're a disaster. Their health is just a complete disaster. Autoimmune diseases like lupus, for example, sickle cell anemia, nonsteroidal anti-inflammatory drugs are toxic to the kidney. So are some of these corticosteroids are harmful to the kidney. Cancer chemotherapy can be very bad for the kidneys. Okay, so, you want to know these things because basically you're like playing chess with death. And the smart thing is, yeah, you want to talk to your doctor, but a smart patient, you learn about it for yourself because you'll be amazed how, like I said, conventional medicine is based on match the ill to the pill and send a bill. Whether the patient gets better or not, it's irrelevant. You still get paid. You can't get sued as long as you gave them the standard drug. So there's really not a lot of incentive to do anything useful for the patient. Imagine you're a nephrologist, okay? You get a big paycheck if the patient's on dialysis. You teach the patient how to eat a very low protein diet. You don't get much money for that. You get a lot of money when they're on dialysis, so who cares? Okay, here's just showing you how the number of nephrons will progressively decrease as a person gets older. So some decrease in kidney function is inevitable with aging. But if you're eating these high-fat, high-meat diets, then it's going to happen more rapidly. And I saw these pictures and diagrams I'm reading about. It reminds me of the brain. As people get older, the brain starts to shrink. And in some people, the brain looks fantastic at 80. So you want to be one of those people. So here's a typical kidney, normal function. You got a big, robust kidney. Let's say its diameter is about 12 centimeters. But it keeps on shrinking from progressive chronic kidney disease and failure due to diabetes, hypertension, and atherosclerosis. And you end up with a kidney that's about 7 centimeters, okay? Yeah, here's a typical shrunken brain. And here's the skull. This is a CAT scan of the brain. This is a cerebral spinal fluid. Normally, the brain should be uptight against the skull. There should be, a little bit of fluid in the sulci, but the fact that the brain is all pulled away from the inner table of the skull, this is an atrophic brain. This is the most common thing I see with cognitive decline in aging, people over, let's say, 55 years of age. Okay. I see lots of 80-year-old brains where it's uptight against, I don't see a lot of them, but I see a decent number of them where it's uptight against the skull. So the more brain cells you lose, more atrophy you get. These are just grades of atrophy. So this would be minimal atrophy, and here's sort of a moderate atrophy. And most of my old demented brains look like this. And these are little strokes, these periventricular hypointensities. This is a T1 sequence on MRI. Okay, so a couple things. High-fat diet, the fat is a bridging molecule. It can cause blood sludge, LDL cholesterol. Stick these together. Triglycerides will do it as well. Fibrinogen, the blood clotting protein, will do this. Uric acid will do this. Bacterial endotoxins will do this, LPS and LTA. So normally these red blood cells, instead of floating independently of each other, they're stuck together. So that's called blood sludge, also called rouleau formation, like a stack of coins. And typical capillary is about 5 microns in diameter. Typical red blood cell is about 7 microns in diameter, so it has to deform to pass through the capillary. If you stick all their RBCs together with these globs of fat and these other bridging molecules, IgM antibodies, the acute phase antibody with an infection also will do it, then it's harder to push the blood through the capillary, so pressure has to go up. The reason you got a blood pressure is to get blood to the top of your head. If you're pumping normal blood, it's like water. You don't need much pressure to pump it to the top of your head. But if you're pumping a milkshake, thick blood, because the RBCs are stuck together by a bridging molecule, then you need higher blood pressure. And if you eat a lot of salt on the meal, it's going to be a vasoconstrictor. Like a pizza is the perfect thing. Full of saturated fat in general, and lots of sodium. It's going to vasoconstrict the arteries. And now you're putting your heart to work. It's got to pump through a constricted system, pump a milkshake through a constricted system to get blood to the top of your brain. So pressure's got to go up. Normal red blood cell's got a negative charge on its outer periphery. It's called the zeta potential. A bridging molecule is a molecule big enough in size with a positive charge that can overcome the zeta potential and stick the two red blood cells together. The higher the LDL cholesterol, the more the red blood cells stick together. You can describe thick blood as calling it blood viscosity. So the more you have these bridging molecules, the higher the blood viscosity. Okay, so here's a normal looking capillary. The red blood cells are flowing through from this side to this side. The little blue circles are the oxygen being delivered to the tissue. In this drawing, it's a neuron, a brain cell. Okay, this yellow line here is the capillary basement membrane. Okay, that gets thickened a lot in diabetes. These are the vascular smooth muscles. Those get thickened in hypertension. Okay, so you have the typical patient. Like I said, most American patients, by the time they're 60, they're fat, sick, and stupid. And by that, I mean they're overweight, they're hypertensive, they're pre-diabetic or diabetic, which means they also got a lot of atherosclerosis. Their capillary basement membranes are thickened from the diabetes. Their vascular smooth muscle is hypertrophied from the hypertension. And now the oxygen has to travel a bigger distance to get to the tissue. So I got fewer blue circles getting up to this neuron. And the higher the fat of the diet, plus if you got other things happening on board to impair blood perfusion, transit through the capillaries, the less oxygen you get to the tissue and the more at risk you are to damage the tissue due to lack of oxygen. That's called hypoxia. Okay, so all these things start adding up and they're all working against the patient's health. So that's why you want to overreact. The typical stupid patient just says, well, I'm cutting down on meat. I'm cutting down on oil. I always think to myself, you stupid idiot. You don't understand what you're up against. You got 10, 20 things destroying your brain cells. You want to stop all the ones that you can. It's like whack-a-mole. There's a lot of them. Okay, so the smart move is fix everything you can, optimize everything you can, hope for the best. Okay, but when people, that's why, Esselstyn will say moderation kills. So the people who kind of just only go halfway in their getting their act together, they usually don't do so well. It's the ones who get a little crazy. Okay, I'm doing everything. Anything else I can do? That's the smart one. The smart attitude is to have an attitude of gratitude. Okay, I'm not inevitably screwed. There's something I can do. Thank you, God. I'll do it. I'll do it. That's the correct attitude. Okay. Let's see. I had a little Hamlet quote in there, and I was working on this. All right. So, anyways, an acid donates protons, and meat, especially protein in general, meat in particular, causes a metabolic acidosis in the body. Animal protein has a lot more methionine, a little more cysteine, sulfur-containing amino acids. Part of the metabolism is to have that amino acid converted to sulfuric acid, and so it creates a metabolic acidosis that has to be buffered by the body. One of the main things the kidney does is it'll secrete these extra acid protons, and simultaneously it'll excrete calcium into the kidney. So that's why animal protein is such a big cause of kidney stones, because you're simultaneously excreting the protons and the calcium. And the calcium in large amounts in the urine is called calciuria. It might precipitate. Okay, and so again, the quote, solution to pollution is dilution. By drinking more fluids, you'll decrease the risk of stone formation. The smart thing is stop eating animal protein. The kidney will also make some bicarb. It'll restore more bicarb. It'll make some ammonia. Okay, those are other things it can do to buffer the acid. And the same patients who have more proteinuria and they've got more other problems in their body. They're more likely to be diabetic, have diabetic retinopathy. They're more likely to have diabetic vasculopathy. Meat is acidic. It acidifies the urine, okay, which increases the risk of kidney stones and increases the risk of kidney failure. Fruits and vegetables, they're alkaline, basic. They lower the risk of kidney stones. They lower the risk of going into kidney failure, okay? Something called PRAL is potential renal acid load. And like I said, animal foods acidify your urine. Plant foods, especially fruits and vegetables, they alkalinize your urine. That's what you want. Let's see what else is interesting. Yeah, the metabolic acidosis also decreases albumin synthesis in the liver, and so you're going to be more prone to hypoalbuminemia, as well as the chronic kidney failure causing more albumin lost in the urine. That's bad. You don't want that. It causes all kinds of problems, and it accelerates the decline in kidney function. The lungs help a little bit, but the kidney is more important for acid-base balance. So here's another diagram. Here's the afferent artery, meaning the blood going into the kidney. Some of it gets filtered out into this space right here. This is Bowman's capsule, or the urine space. Primary urine's up in here. The blood that doesn't get filtered out, continues on through the efferent arteriole, and then it goes into the tubule. This is called the PCT, proximal convoluted tubule. And then the proximal convoluted tubule got all kinds of receptors to reabsorb the good stuff. And then the bad stuff that you don't want, your urea, for example, primarily is going to be excreted out here in your urine, okay? You'll reabsorb some bicarb, especially if you got a metabolic acidosis to treat that, okay? You'll secrete hydrogen protons, the acid, into the urine and simultaneously secrete the calcium. And this simultaneously secreted calcium can be turned into kidney stones, okay? Here's a little more detail of the glomerulus capillary. Just that you've got a fenestrated endothelium, meaning you got holes in the endothelium. Then you've got the glomerular basement membrane. All of this, of course, has a zeta potential negative charge on it. And then you've got these podocytes, foot cells. They look like little feet. And they kind of look similar to like what astrocytes with their foot processes look like in the brain. But the bottom line is this is a very sophisticated filtration system that tries to only allow the bad stuff, if you will, to go into the urine. And some of the good stuff gets in there, but it's pretty good at taking that back out, reabsorbing it. But that's what it's supposed to do, okay? It's worth remembering that albumin has a kilodalton molecular weight of about 69, okay? And that normally should not make it into the urine. If a little bit does, you can reabsorb it, but you don't want to overflow it with it or you won't be able to reabsorb it. This is the potential renal acid load. The bottom line is all the animal foods got a lot of acid. There are some plant foods that are slightly acidic, a touch of acidity in bread and rice. Pasta, no, but then the fruits and veggies are the best. Veggies are the most alkaline. Notice that fish is the worst. It's the most acidic. Fish and chicken have somehow escaped the bad reputation of meat. If I talk to the average stupid patient, I'll have a patient. The guy will be 100 pounds overweight, getting his foot chopped off for diabetes, open heart surgery. And I say something to him like, sir, you might want to try improving your diet. He goes, no, doc, it's not diet. I eat really healthy. It's just genetic. My brother had open heart surgery. My sister had open heart surgery. This guy will be like 50, okay, like 10 years younger than me. And he's like, oh, it's just genetic. And I'm like, did you ever think, maybe the reason your sister and your brother and you all have the same disease is because you eat the same thing? It's not genetic. It's very stupid to blame things on genetics unless you've ruled out everything else. Because once you blame it on genetic, what you're saying is there's nothing I can do. It's genetic. There's nothing I can do. You don't want to do that. It doesn't mean you're smart to say it's genetic. It means you're stupid. Okay, here's the next thing. Here is a big old dinosaur, okay? You can imagine there's an elephant in here. Because a real common thing people say is, oh, how can you eat a plant-based diet? Where are you going to get your protein? All these giant animals, they eat plants. A horse eats plants, okay? A rhinoceros eats plants. You don't need to be eating meat to get protein. There's plenty of protein. We really don't need much at all. I'm going to go into that a little later. Here's a pretty good paper on metabolic acidosis. One of the things I found interesting was right here. An increase, in postmenopausal woman suggests that Net endogenous acid production resulting from the usual cetogenic diet promotes increased degradation of muscle protein. Okay, that's a really jargon, fancy way of saying is the more protein they ate, the more they lost muscle mass. It caused the metabolic acidosis due to increased protein ingestion led to them to lose muscle in postmenopausal women. The reason I bring that up is there's a lot of people out there trying to say that old people need to eat more protein. I think that's absolute nonsense. Old people pretty routinely are in mild kidney failure. Okay, and the last thing they want to do is lose more muscle mass. So eating more protein makes things worse. It tends to make proteinuria worse. It tends to cause more metabolic acidosis, more muscle wasting, more osteoporosis. All those blues owners, people, they live in illiterate rural areas, most of them. Okay, they don't go eating protein supplements. I just want you to know that because that's one of the big sales pitches. Oh, the old people need more protein. Nonsense. Okay, that's the only thing I want to say. And as far as meat is concerned, like I said, there's an old saying, you can't polish a turd. You can't win with meat, okay? I actually am glad that there is a supply of meat and eggs and all that stuff just because it adds a safety valve, safety net, if you will, to the food supply. But if you want to optimize your health, it's just not the way to go, okay? All right, here's a brief comparison of plants and animal foods. And by the way, I would have never imagined myself to become a vegan. When I was a young guy, I was a macho man. I was a college wrestler, student athlete of the year, record holder at Stanford for most wins in wrestling. I thought vegetarians were like, hippie, long-haired, sandal-wearing, Grateful Dead T-shirt, pot-smoking scumbags. Okay, I would think it was just for absolute losers who I would want nothing to do with. I would have this idea of it was, draft dodger degenerate. I was a straight arrow freaking wrestler, man. And and that's how we were. Okay. We wrestled the Russians. We hated the Russians with a bunch of commies. Okay. So what I'm trying to tell you is I come to this at the exact opposite of what I do. And I don't care about animal rights. I mean, people should be nice to animal rights, but I'm letting you know the reason I'm interested in this is because of health. Okay. I want people to be nice to animals, but in my experience, animals rights people usually aren't that nice of people anyways. Okay, and I had considered being a wildlife biologist, so I'm quite familiar with the wildlife biologist, and I left that because they were such a bunch of jerks. They hate people, okay? So I tell you these things that I have no goal with nutrition other than optimizing health. Okay, plants basically have all the good stuff. They've got all the fiber. There is no fiber in meat. Plants are high in potassium. Animal foods and processed foods are high in sodium. Potassium is the good stuff. Our ancestors thousands of years ago ate probably about 20, 25 times more potassium than sodium, whereas nowadays people pretty routinely eat about 10, 15 times more sodium than potassium. And Burkett said we're the only animal that eats more sodium than potassium. Okay, so potassium is the good stuff. It's the vasodilator. Magnesium is also the good stuff. M for magnesium, M for mellow. It inhibits overstimulation of your brain cells, the NMDA receptor for glutamate. Okay, it mellows you out. It's a vasodilator. You need it to control ATP. You need it for all your potassium, sodium membrane ATP pumps. Nitrate is a precursor for vasodilation to make nitric oxide. And plant foods contain antioxidants, so it ends up turning into nitric oxide, the good stuff, okay? Because I know you're going to hear the word nitrates, synthetic nitrates in the context of meat, and they're bad in meat because there are no antioxidants, and they get made into carcinogens like nitrosamines and nitrosamides, but that's different in plants, okay? That's just one of those things that comes up. You got a lot of antioxidants in plants because they need the chemicals to protect themselves from the excessive hot sun, for example. They're alkaline, so it's all good, okay? They're low in protein, except for beans. You want to be low in protein. Complex carbohydrates is starch. There is phosphorus in plants, but it's poorly absorbed. It's bound in phytase, which is what you want. You don't want to absorb the phosphorus. Okay, the iron is also poorly absorbed, whereas in meat iron, heme iron is heavily absorbed. Phosphorus in animal foods is moderately absorbed unless it's an additive, like when they add it into chicken as a flavorant and to prevent purge, then it's like 100% absorbed, and it's bad for you. Okay. There's a few. I don't like these high-fat plant foods. I'm a big believer these high-fat plant foods are an idea. They're another thing that in my opinion, gets heavily over-marketed. In my opinion, I call that the high-fat phony school of over-marketing all that stuff. Okay, sat fat causes lots of problems. The more sat fat you eat, the more likely you are to get proteinuria. Sat fat causes bridging of the RBCs, increases total cholesterol, LDL cholesterol. It also does something called increase in MPO. I'm going to show you pictures of all this stuff, but just so you heard it, myeloperoxidase, and that'll damage the endothelial glycocalyx, the lining of the arteries. And so it damages. We all know that high sat fat diets are associated with leaky gut, damaged gut barrier, okay? We know that they're associated with damage to the blood-brain barrier because the normal fiber, dietary fiber, the good stuff, gets taken by the gut bacteria. They make it into butyrate, short-chain fatty acid, 4-carbon short-chain fatty acid. It's like butanoic acid. And that is used by the gut lining cells to make tight junctions so you don't get leaky gut. But the butyrate also goes through the blood, goes up to the brain, and in the brain takes the butyrate and also makes tight junctions out of it. So when you don't have enough dietary fiber, you get a leaky gut, leaky blood-brain barrier. And what's interesting now is that you also get a tendency towards leaky blood-kidney barrier. The glomerulus starts to leak, becomes increasingly permeable to your albumin. And remember, albumin was just big enough to not get filtered. And now it starts getting filtered. And when you start dropping your albumin into your kidney, that's a major bad prognostic sign that you're likely headed towards rapid kidney failure unless you reverse that trend. Okay, animal protein, like I said, more methionine and cysteine, so it's more acidic because of sulfur-containing amino acids. It activates increased mTOR, so it's more likely to speed up cell replication, accelerate your aging, accelerate the growth of cancer. It has more leucine in it, which also facilitates increased activation of mTOR. mTOR is like a nutrient sensing pathway, like a contractor getting ready to build a building. Can't build till it has all the building materials. Rate limiting step tends to be leucine. Also, it can be sat, fat, and it can be iron. Animal foods high in all those things: leucine, sat, fat, and iron typically. Okay, so that increases your risk of cancer, accelerates aging. It's all bad. Animal protein just in and of itself will increase total cholesterol. That's not a misprint. In and of itself, animal protein will elevate cholesterol. I think it's because it induces a little bit of a hyperbolic anabolic phase whereby you're going to build more stuff, so to speak. So you need to start transporting more cholesterol through the blood, which makes it more prothrombotic. The metabolic acidosis is also pro-cancer. It creates a tumor microenvironment, tumor milieu that is more pro-cancer. So that's bad. The acidity has to be buffered by the kidney, so it excretes calcium with the protons, the acid into the urine. And the calcium, some of it's leached from the bones, so you get osteoporosis. Some of it's also leached from the muscle. You get muscle wasting. Bad. Fish, the most acidic thing. Fish is for chumps. I think all this you need omega-3 stuff is totally overrated. Low-fat vegan foods. I agree with Dr. McDougall in my study of the literature on the old papers that they were good enough, and they tell you don't need to be chasing this stuff down. These healthy people in these blue zones aren't taking O3 supplements with aging. O3, it increases your risk of prostate cancer, increases your risk of atrial fibrillation. It's immunosuppressant, increases your risk of prostate cancer. In animal studies, increases the risk of metastatic disease. So give me a break on that one. Okay, uric acid increased by meat, more purines. Also, alcohol will increase the risk of it. It'll increase your risk of gout, but high fructose corn syrup leads to more production of uric acid. It's a bridging molecule. It's prothrombotic. It inhibits endothelin nitric oxide, so it's a vasoconstrictor, increases the risk of gout, increases insulin resistance. It's all bad. So basically, it goes on and on. I could go on and on meat, all the problems. More advanced. I don't want to bore you with this word slide, but more advanced glycation end products, more arachidonic acid, omega-6 fat associated with inflammation, lipid peroxides. Okay, you don't get almost none of that in plants. More estrogenic chemicals used to fatten up the animals. More phosphorus availability. More heme iron absorption. We talked about more sodium. It's often fried, so you get all the problems of that. And the POFA from the nonstick cookware can get into your blood, and that's toxic. Xenocylitis, because its sialic acids can mimic our own and confuse the immune system. You can have viruses in animal foods, bioaccumulated herbicides and pesticides on these CAFO-fed livestock, eating GMO corn spray with atrazine, soy spray with glyphosate. High temperature cooking of meat leads to production of these toxic chemicals like heterocyclic amines. Also polycyclic aromatic hydrocarbons, PCAHs get increased. You got TMAO made from meat that's atherogenic. It's also a kidney toxin. There's no dietary fiber, again, associated with leaky gut. It changes the gut flora, and you make more of these other toxic chemicals, something called p-cresol sulfate and doxyl sulfate that are toxic to the kidney. So it's just piles and piles of bad stuff. That's what I meant by you can't polish a turd. You see all these paleo, keto, carnivore, low carb, phonies on the internet, trying to intimidate people with all their bluster about, meat made them healthy. Give me a break. You can't polish a turd. It's just too bad in different ways. I gave a previous lecture on does meat cause cancer, and there's like over 30 ways that it increases cancer risk. Okay, so between meat, saturated fat, and increased iron and all the stuff that's in it, you can't win with that. There's just no way to win with it. Okay, foods. So what's the best diet to protect the kidneys? You want to avoid all these high protein, high fat foods. Okay, fat in particular is pretty bad because, what are the main things that lead to kidney failure? Hypertension, diabetes, and obesity. Well, what do animal foods do? They cause obesity. Same thing with processed foods. And they also cause hypertension. Okay, the bridging molecules cause high blood pressure. They stick the red blood cells together, so you got to pump at a higher pressure. Sodium, the vasoconstrictor, uric acid, vasoconstrictor, you're going to have to pump at a higher pressure. Okay, so they're all screwed. What do you want to eat? You want to eat low-fat plant foods. Okay. Look at your fruits. They're low in fat. They're low in protein. They're alkaline. That all sounds good. Walter Kempner had fantastic results treating his kidney failure patients with the rice diet. Rice is only 1% of calories from fat. Depending on what rice it is, it has anywhere from 7 to 9% of calories from protein. So let's just call it 8%. In order to also lower his protein, he would have him eat some fruits. They could drink fruit juice. And he would also let him even have white sugar, which is just fructose and sucrose, 50% of each, just because it has no nitrogen in it, okay? So he wanted to avoid that. And you want to keep your diet low in advanced glycation end products. That's another problem with nuts. A lot of people try to pretend that nuts are such a great food. I'm not a big fan. Not only are they super high in fat, they're also high in advanced glycation end products. Let's see, what else? Yeah, you can get your protein down really low. Sweet potatoes only have 4.5% of calories from protein. They're like the lowest protein containing starch. I think they're probably the healthiest food in the world. The Papua New Guinea population ate 93% of their calories from sweet potatoes. So their total protein was in the ballpark of 5% or less. Okay, they're real fine, strong, and fit. Breast milk has only about 5% of calories from protein, and that's our most rapid phase of growth. And that's perfectly adequate to help a person grow rapidly. So you really don't need much protein. The whole rest of your life, you would need less than that. I'm telling you all this because a lot of people are going to tell you, oh, you don't want to go too low on your protein. Yeah, why not? Okay, this one study by Golden in 1982, here it is in the Lancet Journal. They were feeding people 2.5% of calories from protein, okay? And this was to resuscitate so-called kwashiorkor. And it wasn't really protein deficiency. These people were just starving, okay? But the point I'm saying is they were perfectly fine just getting 2.5% of their calories from protein. You really don't need much. Okay, so here's glucose. It's just, carbohydrate, hydrated carbon. There's a H2O like water. Hydrated carbon is a carbohydrate. Okay, here's fat. Fat is much more dry, if you will. You don't have all these waters on it. But again, the key point is no nitrogen. Here's an amino acid. So an amino acid, here's the amino group, NH2, and here's the carboxylic acid. Okay, so that's an amino acid. It's an amino and it's an acid. All right. And then the variable is the R plus. You combine them by making what's called a peptide bond. And then certain foods will have more or less of these different amino acids. Okay. So like beans, for example, are low in methionine. Peas are low in methionine. Okay. Certain other grains, rice is low in lysine. So what this is all about is, that calorie restriction makes people live longer. They've also shown in animals that protein restriction makes people live longer. Nobody wants to calorie restrict because that's kind of like starving yourself. But you can protein restrict, and you can even just restrict like one amino acid. And they think potentially in animal studies that you can get significantly improved longevity just from doing that. And that might be easy to do, to just restrict one amino acid or something. So that's something to think about. Okay, a little bit about animal protein versus plant protein. Typical animal food has no carbohydrate other than milk. So like salmon is a typical one. 50% fat, 50% protein. Okay, that's a ton of protein and a ton of fat, and it's mostly sat fat. Even the so-called fish has a lot of sat fat in it. So I'm not going to go into this too much more detail, but plant protein is a lot better. And what I'm trying to say is just use your brain. Look at the common sense here. If you go to the zoo, the zookeeper knows what to feed the animal. They've got a nutrition expert PhD. I used to know the guy at the zoo. I was friends with him. And he's like, these are expensive animals. We have to know what we're doing to feed them correctly so they live long, okay? And what I'm trying to say is it just makes sense. Whole food, low-fat vegan, no oils. It can reverse coronary artery disease. That's been shown by a bunch of researchers. It's even been shown now to reverse congestive heart failure in a couple patients. It's the best way to prevent obesity or reverse it. Like I said, 1 billion out of 1 billion rice eaters in China can't be wrong. They're all skinny. Look at a Bruce Lee movie. All the extras are skinny except for Bolo, and he's taking steroids. Okay, it's the best way to prevent hypertension. It's the best way to prevent diabetes. It's the best way to prevent autoimmune disease. It's the best way to prevent kidney failure. It seems to be the best way to prevent cancer based on the incidence and some case reports or reversals. It seems to be the best way to prevent dementia. Okay, there's a lot less dementia in these rural areas where they're eating that way than in more industrial areas, or they're eating more Western. So based on the epidemiology, the molecular biology, biochemistry, it all works. And in the Bible, Genesis 1:29, every fruit and seed will be food for you. So what I'm trying to say is it just makes sense that it's a species-specific optimal diet. Of course, we're omnivores. We can conquer the globe and live in any environment, but it makes sense that we're designed this way, okay? I just tell you this because I see all these poor, pathetic patients, and in my opinion, they're just so pathetic. It's been really cold the last week, and I see this and I talk to my friends. All the hospitals are full. You would think that when it's below zero, like negative 10 degrees outside, and all these patients, they come in for their CAT scans, their ultrasounds, their blood tests, their colonoscopies. They want to be proactive, do something for their health. So for every, 50,000 that come in for all that stuff, maybe one becomes a vegan, low-fat vegan. Okay, but it's a low-fat vegan that'll save them. All that other stuff's not going to make much difference. Okay, there'll be a couple occasional saves, but there'll be a whole bunch of false positives, a whole bunch of unnecessary procedures and medications that torture and bankrupt the patient. When, the smart money's on low-fat vegan. How did I get involved in this? Because I was fat for a brief amount of time in my 30s, and my parents were sick, and I had to turn things around. And I'm like, holy crap, this is where the great power is in health. It's in this low-fat vegan diet. That's why I'm interested in it, because it's one of the few things that works. Here's the golden paper, about 2.5% of calories from protein was perfectly adequate. Associations with functional decline, red meat, sat fat, albuminuria. Your kidney failure just worsens and you're screwed. Okay, well, I'm not going to get into all those details on proteinuria. The more dietary acid, the more you progress to end-stage renal disease, ESRD. You also get something when you eat animal food, the meat, you get what's called hyperfiltration. It's sort of like working triple shifts for the kidney. To do that once in a while is not a big deal. Our ancestors, sometimes they did hunt animals and they ate a bunch of meat in one day. Fine, but it wasn't a big deal to do that once in a day. But Americans tend to do that every single day. Eat meat and high-fat foods, and they overwhelm their kidneys. Dialysis, acid load. The more acidic the diet, the more animal protein. Again, the more strong your association with being fat, overweight, non-alcoholic fatty liver, diabetes, chronic kidney disease, cancer. All these bad things go together. These are the chronic Western diseases. So the smart move is don't eat like the modern Westerner. Eat more like our ancestors did when they were walking around outside scrounging around for plants primarily, okay? Look at your teeth. Your teeth are flat, okay? They're not that good for tearing into flesh. If you're walking down a path in a forest, okay, and let's say you see a dead carcass of a deer on the side of the trail and there's flies buzzing around it. Do you want to get down on your knee and take a bite out of it? No, it's inherently disgusting, kind of gross. Your teeth can't even penetrate its hide, all right? The only reason people eat meat is they salt it and ketchup and steak sauce and all that stuff, okay? Whereas if I put a bowl of fruit next to you on a table or on a tree stump or something, you intrinsically would want that, okay? I think we got color vision so we can eat fruits, by the way. All right, this is just showing high dietary acid load. It's not just associated with more kidney stones. It is associated with kidney stones. It also leads to osteoporosis, increased cancer risk, increased atherosclerosis, increased diabetes. It's all bad, okay? They all go together. That whole Western high-fat diet, high animal protein diet. Let's see. Plant-based diet's much better for protecting the kidneys, okay? It's obvious. Okay, this is just some paper that shows the benefits. You got to be a little careful about potassium being high, but elevated potassium is not as big a deal as people thought it was. The old literature exaggerated the significance of it. People don't tend to have a problem with potassium until their GFR gets really low. And that can be monitored closely on an individual basis, but it's an exaggerated potential problem with the plant-based diet. The benefits are they'll have better blood pressure, less likely to get diabetes, be fat, all these other things. These are just more benefits. It alkalinizes the blood, less phosphate, has more fiber, etc. Okay, we talked about all this. Oh, here's a good book. If you want to read about kidney failure, the two best books there, this is one of them. So the author's name is Lee Hull, Evidence-Based Guide to Kidney and Renal Diets. He's a guy who had focal segmental glomerulosclerosis, and he wanted to save himself. He's diagnosed about 25 years ago, and he did a great job of maintaining his kidney function, and he's smart. He's not a medical health person, but he's smart. This is, I think, probably the best book. Now, I have not read the book of that lady, Jennifer Moore. She's a dietitian, but she's got a lot of lectures on the internet. She's quite smart, and I've been impressed by her lectures. So I haven't read her book, but I'm sure it would be good just because her lectures are good. So those are the two people you want to know about, Lee Hull and Jennifer Moore. She's a dietitian specializing in kidney failure. So if you got a kidney failure, you got somebody in your family that has it, I recommend these two. I think they're both good. I do think he exaggerates a little bit on the benefit of keto analogs. I'll explain what that is. Okay, here's a keto analog. So here's an amino acid, and again, it has an amino group and a carboxylic acid, and an R group, and then a hydrogen, all right? But you can take off this nitrogen, the amino group, NH2 is an amino. You can take off the nitrogen here, and now you've got the keto analog. So this is what's called a keto acid, okay? Meaning that the acid is here, and then the ketone is right here. So keto acid. Anyways, this in the body can be converted to this protein. So what they're saying is in order to reduce the dietary load of nitrogen to thus decrease the workload of the kidney, you can feed the people these commercially produced keto analogs. They're called keto analogs. And that is a way to give the person what they need, the skeleton, the carbon skeleton, if you will, to make an essential amino acid, because there's about eight amino acids that are essential. You need to get them from your diet. You can't just make them on your own. So you can give the person the keto analogs for those essential amino acids, and then they can steal the nitrogen from somewhere else and convert it into an acid. So that's one way that a person can eat a low-protein diet. And the goal here is you got this failing kidney that can no longer excrete so much nitrogen. So what you're doing is you want to drop your dietary intake of nitrogen. That's how you protect your kidney. Okay. And they do tend to be pretty helpful, but so Lee Hall, he loves them, author of Stopping Kidney Disease in the book I just showed you. Whereas Jen Morris, she says, yeah, sometimes they're helpful, but be careful. They're pretty expensive. Okay. So like I said, that was a real good book. A little bit about the numbers. Let's do a little number crunching. Typical recommended daily allowances, they'll tell you should eat 0.8 grams per day of protein. And you can do the math in a 70-kilogram man. That's about 11.2% of calories. But they almost always exaggerate in all of their recommended daily allowances. All that stuff tends to be exaggerated. Just to eat a low-protein diet, you're going to drop your number of calories down to about 8.4%. And remember, what's his name? Kempner had his patients doing great. And I forget, he was in the ballpark of 3 to 4% of calories from protein. And very low protein diets are like 0.3. Some people even say 0.28 grams of protein per kilogram of body weight per day. And that'll get you down in the ballpark of about 21 grams per day of protein, which is only 4.2% of calories. And what I'm saying is the Papua New Guinea guys are a bunch of hyperactive muscle men running around eating sweet potatoes, okay? So you really don't need much protein, okay? If I had the problem with this, I don't. But if I did, I would get my protein down as low as I could to slow down the destruction of the kidney, because you don't want to go on dialysis. You want to avoid that if you can. You don't want a kidney transplant if you can avoid it. Kidney transplant, I think it's like a walk in the park. Oh, I got a kidney transplant. I'm all solved. No, you got to take immunosuppressive drugs. Lots of kidney transplant patients have complications. They get it fails to thrive. It doesn't function well. It gets rejected by the body. Post-op hematoma, post-op abscess, post-op drainage, post-op renal artery stenosis, needs to go for angioplasty stent. It's not a walk in the park, okay? The best thing to do is save your kidney, protect your kidney. Let's see, what else? Some of the things I didn't like in the book, he didn't talk about any of the great nutrition history, He wrote an entire book about the kidneys. He doesn't ever mention Walter Kempner. To me, that's insane. Kempner was saving patients' lives back in the 1940s, 50s, 60s, and 70s before dialysis was available. Okay, he was not messing around. Kempner not only was trained as an internal medicine doctor, he was trained as a nephrologist. I think the guy was a genius. Some people think he's the greatest doctor who ever lived. Okay, so it's like, how could you not talk about Kempner? What is that? All right. P-cresol sulfate, indoxyl sulfate, we're not going to get into that too much. It's sort of a minor thing that takes care of itself if you do all the other stuff right. I recommend, I call it the Spartan vegan diet, for most people. But for a kidney failure patient, I would eat the low-protein version of it. Like I would not eat any beans, for example. The psychosocial stuff is just helpful because everything functions better when that's under control. This guy, James Mitchell, PhD from Harvard, was a real smart guy. He gave a real good lecture at the Buchinger Wilhelmy Clinic on the benefits of low-protein diets. And what he said was, low-protein diets appear to increase longevity, and you could potentially just restrict methionine. And, by restricting a single essential amino acid, you get the same effect as calorie restriction and live longer. He was impressed by Kempner's work, and he said that he thinks it makes people skinny because what he's saying happens is that the body starts becoming a little short on glucose. And normally it would run gluconeogenesis, and it would use proteins as the carbon substrate, but instead it'll have to break down triglycerides. And so the fatty acid is just burned as wasted fuel, but the glycerol 3-carbon molecule is used in the second half of gluconeogenesis. They're going to use it to make sugar for the brain. All right, so what's the point? Because you got to break down triglycerides, you get skinny. So what he's basically saying is eating a low-protein diet helps a person lose weight. Low-protein diet helps a person lose weight. That was what his research came out of that. This guy's real smart. I was impressed by him. You could go to that lecture, go to Buchinger Wilhelmi Clinic, and you see his lecture. You'll be impressed by this guy. Okay, here's Kempner's work. Here's what Kempner was feeding people. Kempner was feeding them, like I said, primarily a rice diet with some fruits and some simple sugar, white sugar, table sugar. He was just feeding them Uncle Ben's rice. It wasn't even organic. He just felt white rice was more palatable. Nowadays, I still eat white rice if I'm going to eat rice. It's got less arsenic in it. Get it organic. Get it from an area that didn't previously grow cotton on the soil, because then they're going to have sprayed more arsenic pesticides for the boll weevil insect problem they used to have. The white sugar was nice because it had no nitrogen in it. Fruits are real low in nitrogen. Let's see what else. He encouraged them to exercise. His diet was about 95% carbohydrate. That's extraordinary. 95% carbohydrate. Probably in the ballpark around 4% protein, 2% fat. Okay. Pretty extraordinary. For some patients who needed to gain more weight, you give them more sugar. So that's why those numbers can vary a little bit. Okay, we talked enough about the difference between animal protein, plant protein. Oh, this is just showing percent of fat. And the point about this is that, you get really low fat in a lot of your fruits. Potatoes, only 1% of calories from fat. Regular potato and sweet potatoes. White rice, only 1% of calories from fat. Lentil as a bean is only 3% of calories from fat. So that's a way to really lower your fat. And this is how you can lower your protein. Your fruits are quite low in protein. Your grains are higher, especially your beans are way too high. Albuminuria. Oh, here's something I thought was interesting called the Steno hypothesis. So Steno is the name of a hospital in Denmark. And they came to the conclusion that albuminuria seems to be a question of endothelial dysfunction in the glomerulus. And it's associated with endothelial dysfunction in the eyeball, diabetic retinopathy, and in the small blood vessels of the body, microvasculopathy, if you will. Diabetics get tons of amputations because you can't bypass it. When you screw up the artery in the foot, what are you going to bypass to? There's nothing to bypass to, just amputate it. So anyways, he claims it's sort of his theory of diffuse endothelial dysfunction. And I think he's right. And I also think, though, but he didn't know back then about the effect of saturated fat. Okay, I'm going to talk about that in a moment. I think that's a little bit interesting. This is just more from the Steno hypothesis article. I thought that was quite interesting. You're going to check other things, know your blood pressure, your hemoglobin A1C, serum bicarb level related to your acidosis. Okay, but let's see, where is something interesting? Okay, yeah, avoid methionine, fine. All right, here's what happens when you get leaky gut. You get these bacterial endotoxins like LPS, lipopolysaccharide from gram-negative bacteria, LTA, lipoteichoic acid from gram-positive bacteria. And they can get into the blood, and they're very prothrombotic. They cause what's called amyloid clotting. Normally, your fibrinogen, your blood clotting protein, it's like an alpha helix, but it changes shape. That's called an amyloid transformation and becomes flat, like a deck of poker cards. And then they stack on each other and bind with each other, creating this giant molecule. The bigger a molecule in aqueous solution in water, like the human body, the more likely it precipitates out of solution. And that means it clots, okay? When you have excess free iron, because you've been eating too much iron from all the meat and all the iron-fortified processed foods, you'll start having free iron around in your blood. Iron is like a fire. You want a fire in your house, in the fireplace, to warm the house. You want a fire on the stove to cook your food, but you don't want fire anywhere else in your house. And that's how iron is. You want iron in your hemoglobin to carry oxygen. You want iron in a couple enzymes. You want it in your electron transport chain, because it's a transitional metal, meaning it can vary its valence such that it can hand off electrons in the middle of a chemical reaction. But you don't want it anywhere else, okay? Because fire anywhere else burns stuff down. And it's the same thing with iron. If you start getting excessive amounts of iron, the body can no longer store it, and you get free iron in your blood. It causes these random clots. It reactivates dormant bacteria. It's really bad. And lots of people have that. Men start getting that after 25 years of age in a Western country. Women get it when they're postmenopausal. They're not menstruating anymore. This is the work of Douglas Kell and Etheresia Pretorius. They're two brilliant researchers. He's from England, English PhD guy. She's a PhD lady from South Africa, and they really deserve a Nobel Prize. They've done a lot of good work. They're some of the most cited authors you'll see in the scientific literature. They're extraordinary. Anyways, they'll probably never get anything because nobody wants, the pros to know about this. But they talk about all the problems with having elevated iron, all the problems with leaky gut, and they're bad. And here's what I actually think. I think that this is making people more prothrombotic than they realize, and it's occluding arteries in their hearts, leading to atrial fibrillation, congestive heart failure. And I think this is occluding arteries, small arteries in people's brains, and making them stupid and demented. And nobody even knows about it hardly, but this is well worth knowing about, because you can get something called microvascular angina of the heart, whereby the big arteries of the heart, the coronaries, the epicardial coronaries on the outside of the heart, they can look clean on a cardiac cath, but the microvasculature can have problems in it, okay? And I think that this is related to that. Okay, here's the glycocalyx. Glyco means sugar. Calyx means coating. So you have a sugar coating on all the cells of your body, including your endothelial cells. And you tend to have polymers of heparan sulfate. This is also called a glycosaminoglycan. You don't need to know all these words. I'm just throwing them out there so you've heard them before. If you watch the lecture. The bottom line is there's a lot of sulfates on there, negative charges. So they've got a zeta potential. Negative charges to have a zeta potential. At the ends of the glycoproteins, you have sialic acids. Those also have a negative charge on them. Those are like the identity cards of the immune system. The immune system reads everything by Braille. It feels the sialic acid, says, okay, you're cool, you belong here, on your way. Okay, water lines up with these. You end up with a dipole. A dipole is a partial charge, and the hydrogens have a partial positive charge, so they line up with the negative charges on the sulfates. And this is the classic version of slippery when wet, okay? So now you got water lining up on the lining of the endothelial cells, so it makes it slippery. So when the red blood cell's passing through the capillary, it can slide through there faster, even though the red blood cell is bigger in diameter at 7 microns and the capillary's diameter at 5 microns. That's how it works. And the white blood cells are, big cells compared to the RBCs, the red blood cells. They're like some of them 14 microns, for example. So they really have a struggle to get through that capillary. Meat eaters have higher white blood cell counts, which contributes to them being hypertensive. Okay, just normally they do because they got a lot more inflammation. Here's a diagram of heparan sulfate. So you got negative charges all over the place. Okay, and this is how, a red blood cell flows through a capillary. There's actually negative charges. It's zeta potential, and the capillary lining, it's glycocalyx, also has negative charge. These are cholesterol sulfates with big negative charges on them. Okay. This is more what we already talked about. One last thing. I know I'm kind of going on a long time, but this is pretty interesting. I'll be done pretty soon. You got your neutrophils. They're your main first responders of your immune system, of your white blood cells, most common white blood cell. They make something called MPO, myeloperoxidase. Okay, it's related to generating toxic chemicals like bleach to kill invading bacteria. Okay, so it's a powerful stuff, MPO. And the relevance is that when you eat saturated fat, it confuses the neutrophils in your blood. And they see it as inflammation, and they start releasing MPO, myeloperoxidase. Okay, here's a paper if you want to read about it. It's kind of an interesting subject. So these little red balls have a positive charge drawn on them, and they interact with the negatively charged glycocalyx, the glycoprotein sticking up, like the ones I was just showing you, the heparan sulfate and all that, and they cause it to collapse down. Sitting down at the bottom, they previously stuck up like trees on a hill, the glycocalyx, the normal glycocalyx. When they collapse down because of the MPO from the neutrophils, shed by the neutrophils, now you'll have molecules like VCAM, vascular cell adhesion molecule, and your white blood cells can bind to them. So you start getting white blood cells sticking to your arterial lining cells, your capillary endothelium. And this can start generating an immune response. So not good. You don't want to damage your glycocalyx, okay? It's the opposite of what you want to do. And so what I'm trying to say is saturated fat is inherently bad. There's all kinds of BS artists on the internet trying to say, oh, saturated fat isn't bad, cholesterol is no big deal. Yeah, it is. It's been known for a long time. It's real bad. And so it's like, believe me, people are not aging well in the United States. Like I said, in my experience, my internal medicine friends, as I say, the vast majority of patients we see 60 years and up, they're fat, sick, and stupid. Okay, they've all got the same diseases. They're overweight, they're hypertensive, they're pre-diabetic or diabetic, and they've got atherosclerosis in their brains, with atrophied brains, and they've got atherosclerosis in their heart. They got atherosclerosis in their Johnson. They're not healthy. Okay, myeloperoxidase, like I said, it collapses down the glycocalyx. Normal glycocalyx sticks up and has a negative charge, and it causes the red blood cells. These are all the negative charges. So the red blood cells, white blood cells don't stick to it. When you collapse it down with the MPO, now these adhesive molecules start becoming exposed because the glycocalyx is collapsed down, and they'll adhere to that, and that can initiate inflammation and even diapedesis, where they start becoming subendothelial. So here's an example. They start sticking, they roll a little bit, then they stick, and then they can start squeezing down and getting beneath the intima. And that's called being subintimal or subendothelial. And this can cause inflammation of the arterial walls, all kinds of problems. You don't want this. Also, this predisposes to clotting. So you're at increased risk for thrombosis, occlusion of arteries. It's all bad. And like I said, what does this? Eating meat. So why would you want to do that? You'll get some distortion of the shape of your red blood cells. Okay, acanthocytes is like little spurring and focal spots. Echinocyte is more like spurs all over the place. All right, so when you distort the shape of your red blood cells, they don't deliver oxygen as effectively. It's not good. You'll also get something called phosphatidylserine externalization, stiffening of your red blood cells, accelerating the rate at which they age. It's all bad, stiffening them. Okay, it does a lot of things you don't want. Okay, this is just about what is methionine. Fruits tend to be very low in it, so that's another thing that makes fruits look good. Nuts can be surprisingly high in methionine. It's another reason why I'm not a big fan of nuts. Look at these numbers. Brazil nuts, 955. Okay. Pistachio, cashew, 310. Okay. You compare that with an apple, 1. I was going to then maybe go into kidney stones. I don't know how long I should keep talking. I could talk about kidney stones. I pretty much covered what I was going to cover about kidney failure. So the bottom line is eat a low protein diet, avoid animal foods and high fat foods, avoid excessive dietary sodium. Potassium to some extent can correct the effects of sodium. Yeah, correct the effects of sodium. Yeah, it's like a vasodilator. Sodium is a vasoconstrictor. Most of the stuff that causes kidney failure also increases the risk of kidney stones. I think I covered a lot of stuff there. Maybe leave that because talk about kidney stones is a whole big other subject.
Do you just want to briefly talk a little bit about kidney stones? Because I think a lot of people here are interested in that.
I just didn't know how much you guys can take. All right, so I'll go through it.
They're still here.
Okay, all right. Well, then I'll keep going. Let me start it up with kidney stones. Okay, so here's an ultrasound, and you can see that the kidney cortex, this hypoechoic outline of the cell, just like a tree stump. You know, cortex means the bark. It is more hypoechoic than is the liver. The liver is relative to the kidney. It is hyperechoic, meaning brighter. Okay, so this is the diagnostic finding in fatty liver. Normally, the kidney, cortex, and the liver should be isoechoic, meaning the same. And by the way, this is so common. If you were to tell me, like you could tell me the patient has elevated LFTs, liver function test, I could say, okay, he's got a fatty liver. Just because 99% of the time when I hear the word elevated LFTs, it means fatty liver. I don't even need to look at the films. I don't need to know anything. All I need to know is the patient has elevated LFTs, fatty liver. Okay. The other thing, too, is I see a lot of patients for kidney stone follow-up, and they almost all have a fatty liver. It's almost all that because there's a lot of paleo keto carnivores saying, what about the oxalates in plants? What about the oxalates in plants? Those can cause kidney stones. Actually, they tend to be more bound, less absorbed, and they just seldom do. Okay. I'm not looking at skinny plant eaters in the kidney stone follow-up clinic. Okay. I'm looking at a bunch of diabetic hypertensives. Okay. That's what I see. It's mostly animal proteins, a big risk factor, but also dehydration is the other real big one. Here is a kidney stone, characteristic appearance on color Doppler. It'll have what is called a twinkle artifact. Okay, it'll also have an acoustic shadow. You can see there's a shadow behind it because it's hyperechoic because the sound of the sound beam reflects back to the transducer, and then there's not sound going past it, so you get what's called an acoustic shadow, a sound shadow. This one's obstructing the renal pelvis at the junction with the ureter, so it's a ureteropelvic junction. Obstructing kidney stone. It's a pretty big stone. You know, this looks like to me like it's about 1.5 centimeters in diameter. So the renal calyces are dilated. So the word for this, the medical word for dilated renal calyces is hydronephrosis. So this is obstructive hydronephrosis due to a UPJ stone, ureteropelvic junction stone. Okay, so the treatment for this would be, you know, I used to do this procedure all the time. I poke a needle through the patient's back into the kidney, thread a guide wire in there, and then dilate up the tract, and then slide a plastic drainage tube in there. It's called a percutaneous nephrostomy, like an 8 French, 10 French tube. So I did like 1,000 of those. Okay, so that's a percutaneous drainage of obstructive hydronephrosis. All right, here's what it looks like on a CAT scan. Normally, the density, CAT scan's all based on density. HUs are Hounsfield units. He's one of the co-discoverers of CAT scans, Sir Geoffrey Hounsfield, English guy. And so normally the liver should be denser than the spleen. You got 40 Hounsfield units over here, 15 Hounsfield units over here. You can just eyeball it. The liver is less dense than the spleen. So this is a fatty liver, diffuse fatty liver. You see this all day long. Fatty liver to me is like saying diabetes of the liver. We talked about how fructose causes fatty liver because unlike glucose, which goes all over the body and it's used by the brain, red blood cells, etc., fructose goes almost entirely to the liver. And in the process of metabolizing it, you produce a lot of uric acid. The uric acid then goes out into the blood, starts causing problems. So that's why you don't want to eat these processed foods that are high in fructose. Okay, if you eat a fruit, everything is slowed down because of the fiber in the fruit and the other nutrients. It takes time to absorb it. So I think fruits in moderate amounts can be good. That's a whole other topic for another day, all the fructose versus glucose and fructose metabolism stuff. But the thing to know is when you eat a lot of processed food, you're going to bump up your uric acid, and that's a bad idea. That increases your stone risk. You're going to predispose yourself to fatty liver, which means diabetes of the liver and diabetes and everything that goes with that. You don't want that. And you also get increased lipidemia. Okay, anyways, here's a kidney stone. This is like the equivalent of that ultrasound I just showed you. Renal pelvis stone, obstructing at the junction of the renal pelvis and the ureter, the ureteropelvic junction obstruction with dilated calyces compared to this kidney. So I'd go through the guy's back, put in a percutaneous nephrostomy drainage tube. That would be the standard thing. So this is what a stone obstruction looks like on a CAT scan. Here is a good book on kidney stones. This one right here, even a urologist gets kidney stones. This guy's a urologist, a little bit fat, and he got kidney stones himself. And because of that, he got more interested in them, and he wrote a book about it. It's a pretty good book. It's sort of a little bit of what I call a baby book. It tells you what you need to know. It goes into a reasonable amount of detail. He doesn't know that much about nutrition, but it's a decent book, and it's got a lot of good pictures in it. So I think it's a good book to give patients who have a kidney stone. They'll be able to understand it. You know, good basic advice. He's going to have them drink a lot of water. Stone formers have to do that. Eat a low-fat diet. Minimize animal protein intake. Okay, good advice. Avoid things that cause increased serum uric acid, which would be high fructose corn syrup, and eating the meat with all the protein. Also, alcohol contribute to that. Avoid dehydration. And there's some other rare causes. This is I found this book more enjoyable. It's a more sophisticated book. No More Kidney Stones. He really goes more into the pathophysiology of what can cause stones, but it's not as well illustrated. It's going to be too difficult for most patients. Acidic urine is the big thing that increases stone formation. So again, avoid your animal foods. Talks about dehydration being important contributor, and it goes through the whole uric acid stuff. So this is a good book too. Okay.
So what was the name of the first book that you said had more illustrations?
Yeah. Let me go back. This one right here is called Even a Urologist Gets Kidney Stones.
Okay.
Yeah, it's a real fast, easy to read book, and it's good. You know, the guy's a urologist. He knows what he's talking about. He just doesn't know that much about nutrition. Like he said, some things I thought were pretty stupid. I think he recommended Crystal Light, that like thing that's like Kool-Aid or something. I think that's full of aspartame or something, I think. So I wouldn't do that. But in terms of just getting the main points across, it was a nice book and heavily illustrated. This book will help you more if you're a person who wants to really understand in more detail. This will go better. He talks about how ketosis is particularly bad for stone formers. Will give you more problems. How being fat is bad for stone formers. He goes into the nuance, the details of it, which I like. But what are you going to end up doing? You're going to end up becoming a low-fat vegan if you're smart. How to prevent kidney stones. Number one, meat risk factor. Avoid eating meat, animal protein. That's the big cause. Like we said, sulfur-containing amino acids will lead to acidic urine. Okay, meat causes acidic urine. Plants cause basic urine, especially your fruits and vegetables. Okay. He'll go through all the details. You also, excess dietary salt will increase your risk of kidney stones. So does psychological stress, caffeine, sleep deprivation. Excessive dietary vitamin D can make things worse. Excessive vitamin C can make things worse. We talked about fructose and uric acid. You can get uric acid stones. And to be hydrated helps for them to not have recurrence. Again, solution to pollution is dilution. Okay, let's see what else is interesting. A little bit about, you want to get your dietary fiber. You can only get that from plant foods. Oh, I wrote a poem about kidney ultrasound. I don't know how much experience. Remember when I showed you that picture of the ureteral jet going into the bladder? We always want to see those because then we know the ureter is open. It's not blocked by a stone. So we scan the kidneys. The tech does the scanning. I'm a doctor. I'll look at the films. And then they scan the bladder to see if you got ureteral jets. You often can't see the ureter itself because it's obscured by bowel gas. But here we go. 5 years have passed with the length of 5 long Doppler scans. And again, I hear these waters rolling from their mountain kidneys with a soft inland murmur. Break, break, break on that cold gray prostate OP. And I would that I could utter the thoughts that arise in me. And what about the post-void? To void or not to void, that is the question. Because we often have the patient try to go to the bathroom if we can't see the ureteral jets because we don't know if they have obstructive hydronephrosis due to a stone. If we have them pee, sometimes that'll open up the ureters. To avoid or not to avoid, that is the question. Whether it is nobler in the mind to face the squirms and groans of outrageous BPH or to get a TERP, benign prostatic hypertrophy, or transurethral resection of the prostate. Water, water, nowhere, and the phallus did shrink. Water, water, nowhere, not even a plink. O peristaltic wave, wherefore art thou? These are the times that try men's bladders. More gel, more gel. Let's take another look. We have to wait a while and go back and see if we're going to see some ureters. But soft, what light on yonder colored Doppler window breaks? Oh, trumpets of prophecy, if ureteral jets are here, can spring be far behind? What's this? The sonographer's gel has activated the wrong pipes. A happy ending all the same. I've seen that happen a couple of times. The lady texts come up to me and they go, does renal ultrasound cause this? Like, oh, sometimes it does. Okay, and these are the poems where I came from. Tintern Abbey, Ode to the West Wind, Rhyme of the Ancient Mariner, Romeo and Juliet, Common Sense, and Hamlet. Let's see here. We talked about fructose-permeating fatty liver, and that's the end. So anyways, hope that was helpful.
That was excellent. Thank you so much, Dr. Rogers. That was just so very helpful. We actually have some questions that came in and some comments too. So let's see. We have, okay, so Angela said, hi, Dr. Rogers. My dad is having trouble with his kidneys, weight, heart, diabetes, etc., and believes that sugar carbs is the worst thing. Fat is wrongly stigmatized. How do I get through to him? Thanks.
Yeah, it can be difficult because people have kind of got it into their brains, and lots of times their doctor doesn't know what they're talking about. Doctors are not trained in what I call NETs, nutrition, epidemiology, toxicology, and things that start with S, like spirituality, sleep, stress, sedentary versus exercise. Okay, so anyways, the best diet, like I said on that one slide, it's whole fat, whole food, low fat, vegan diet, ideally 100% organic with no oil. And how do you get a paste in that point? Well, one thing I tell a person is look at the epidemiology. If you look at China, 1 billion out of 1 billion rice eaters, they're all skinny. And then they don't get diabetes, they don't get hypertension, they don't get autoimmune disease. What more could you want? In Africa before 1959, there was no rheumatoid arthritis. There wasn't a single reported case. The plant-based diet, it protects against all these things. And then you say, well, what about atherosclerosis? Because that's what people eventually die of. They plug up their arteries in the heart with atherosclerosis. Well, first thing to know is atherosclerosis is a blood clot, and your physician probably doesn't know that. By the way, I did a fellowship in imaging-guided surgery at Harvard with the emphasis on vascular disease. I've been interested in atherosclerosis for over 30 years. I'm friends with Gregory Sloop, the best atherosclerosis researcher in the world. He's a pathologist. Pathologists are the true experts of atherosclerosis. And you'll say, well, why is that? Because people tend to think, well, the cardiologist is the expert of atherosclerosis. They're putting in the stents, or the vascular surgeon, or the cardiothoracic surgeon. They're bypassing the blockages. And what I'm going to tell you is they're a bunch of plumbers, okay? They see a blockage, they got to get the rotor-rooter, let's try to open this up, or let's just place a graft across the stenosis. Okay, that's nice, but that doesn't really solve the patient's problems. Open heart surgery doesn't increase longevity for chronic cardiac angina because it doesn't treat all the small vessels that are plugging up the muscle. It doesn't treat the small plaques, the vulnerable plaques that are prone to rupture. So what I'm trying to say is when you have a systemic diffuse problem that's everywhere in the body, there's only two ways to get to that. You can either get to that with a pill. Pills have lots of side effects and often don't work, or the diet. It's been proven that a low-fat vegan diet reverses atherosclerosis. Walter Kempner did it. He reversed tons of EKGs. Nathan Pritikin showed that it was reversible. A guy named Anderson did that in animal studies, and Armstrong did that in animal studies. David Blankenhorn, he showed whatever fat you eat, it doesn't matter if it's omega-3, omega-6, sat fat, they all worsen atherosclerosis. Olive oil, they're all bad for atherosclerosis. So the only thing you can do is lower your fat intake. Okay, the low-fat populations, they don't get atherosclerosis. Look at the Yanomamo in South America. Look at the Tarahumara in northern Mexico. They don't get atherosclerosis. It's obvious. The only reason there's confusion is imagine you owned a big food company or you owned a cattle company. You have to keep the public confused. Okay, I'm 60. I don't have any medical problems. None. Zero. I don't take any pills. I'm a low-fat, low-sodium vegan. That's what you want. Okay? So, and the low-fat, low-sodium vegans, they're the only ones that are like that. You know, and then you're always going to run into somebody who says, my uncle, he lived to be 95. He smoked cigarettes every day, had a couple of beers, and he ate steak. Okay? And you know what I would say to that? You know, you can take 100 blind people and push them across a busy street, and some of them will make it, but it doesn't mean it's a good idea, okay? You don't have good odds when you're eating these high-fat diets, all right? You have terrible odds. The vast majority of patients, they're all fat, sick, and stupid. Like I say, they're kind of generic, okay? You don't even need to look in a chart. Like somebody tells me, I'm in a hurry, you got to do this biopsy. And I go, well, what do you know about the patient? They go, oh, it's a 65-year-old guy. I don't even look in the chart. I automatically assume he's got diabetes, hypertension, he's overweight, and he's got coronary artery disease, okay, cerebral vascular disease. It's automatic. That is almost always true. So what I'm trying to say is the only way to win the game in these other countries like Yanomamo, Tarahumara, they got the same blood pressure when they're 12 years old as they do when they're 70. They don't get hypertension, okay? So what I'm saying is that's how you can figure out the question, because there's always going to be people, typically they're confused. There's all this contradictory information. So they go, oh, well, I give up. I'm just going to eat whatever I like. And so what I'm saying is look at the epidemiology. You get past the nonsense and you can see that people who eat these low-fat plant-based diets, they don't get these diseases. And so that's your best chance. That's really pretty much your only chance. Like I said, coronary artery stents, they don't increase angina. They don't increase longevity for chronic cardiac angina. And you bill $150,000 for open heart surgery. You bill $30,000 for each stent. So that's where the money is. And so imagine you ran a hospital. You would hate these low-fat vegans. They're going to cure all your patients for nothing, maybe $1,000 here and there. Whoop-de-doo, I can get $150,000 for every open heart surgery. I can get $30,000, $60,000 for every stent. You want your cardiologist in the stent room busy. You want your open heart surgeon busy. You want to fire that low-fat vegan, get him the heck out of here. What is he, insane? Curing patients, losing money? You cure a customer, you cure a patient, you lose a customer. There is no money in this low-fat vegan stuff. I do it for moral reasons, righteous reasons, and to show off how smart I am, okay? But there's no money in it. I don't make money doing this. I make money with conventional medicine. It's how it is.
Well, thank you for that, Dr. Rogers. Okay, we have, I think that, we have a comment. So Karen said, Peter really tells the truth. We can trust what he says. So many people promote oil, nuts, and seeds, and nut butters and supplements. Peter doesn't sell stuff, so he has built trust. Okay, so I thought
thank you. It's true.
Share that with you. And so Just Eat Plants wants to know how does kidney cancer?
Yeah, kidney cancer, increased risk, of course, with smoking. There's also some toxic chemicals that can increase the risk of kidney cancer. You could also get into, is it may be related to the Warburg effect, from tissue hypoxia, lack of oxygen because of atherosclerosis. I haven't really been thinking about kidney cancer lately, so I'm not up on all the toxic chemicals that might cause it. I don't see it that much, but that's sort of the classic associations. Every cancer is thought to be worse with, these high-fat, high-animal food diets because they're cancer promoters, the tissue hypoxia and the activation of mTOR. So like if I wanted to avoid the risk of kidney cancer, it's the same answer as usual. The species-specific optimal diet, low-fat, low-sodium vegan with no oil. And, of course, you don't want to be a cigarette smoker. You don't want to be drinking alcohol. You don't want to be exposing yourself to any other toxic chemicals. No marijuana, no nothing else. And you don't want to be working around toxic chemicals, too, like a painter. You can work around different types of paints and dyes, and these things will get inhaled into your blood and excreted to your kidneys, and some of those things can be toxic to the kidneys as well.
Well, thank you. Ginny said, congratulations on your channel. Thank you. And today's excellent guest, Dr. Peter Rogers. Please let him know that I am his Mexican student who shares his knowledge with people suffering from chronic diseases. I thought you might.
Yeah, well, thanks.
So Marley loves your art and wants
Thanks.
And said, when you were talking earlier about protein, this is so controversial, and now especially with pushing women to keep muscle after menopause.
Notice I didn't sell you anything.
Mm-hmm.
Okay, you can look up everything I said. Look at the Medias paper on metabolic acidosis of meat and protein. Okay.
Right. So, but I mean, we don't necessarily need, as women who are, especially after menopause, women don't necessarily need lots of protein in order to have muscle mass to help prevent or help heal menopause. I mean, osteoporosis and things.
Yeah, the more animal protein you eat, the more osteoporosis you get. That's why I laugh. I gave a lecture about the Bantu. The Bantu are these women in South Africa, okay? So first of all, they typically have about 10 babies. The average American woman, what's she having nowadays? 1.5 babies, okay? They're having 10 babies. They nurse each baby, not for 1 month and go back to work and then give them formula. No, they nurse the baby for 3 years, sometimes 4 years, okay? He's sucking all that calcium out of her body, all right? And then on top of that, she has 10 of them, 10 babies, okay? She's always either pregnant or nursing, all right? And that's what she does her whole premenopausal life. And the reason I think it's funny is because she doesn't have any problem with osteoporosis. It's a non-issue. They get almost no calcium in their diet, okay? They get like the amount that there's in one tiny little cup of milk. You get plenty of calcium from plant foods. There's no calcium shortage, all right? That's all nonsense to trick you guys into buying stuff, okay? And like I just told you, the last thing I would recommend for these old people is high protein diets. They're already in mild kidney failure. Just finish off their beans faster. We call the kidney the bean. And it also causes muscle wasting. You know, Jennifer Moore's lecture, she talks all about the muscle wasting from high protein diets. So, like I said, the Bantus are not eating high protein diets. All these other blue zoners and these traditional populations that are robust in their 70s with no hypertension, no diabetes, nothing, they're just eating primarily plant-based diets.
Yeah, and so often people recommend high protein in order to keep muscle after menopause, when actually you need to be doing weight-bearing exercises in order to produce the muscle. So that's an important thing.
Yeah, I would say, like, I'll give you a perfect example, like in a hospital, all right? When I go to a hospital, if I have to work upstairs, which I often do, I always take the stairs. No exceptions, okay? I'll run up 10, 12, 13, 14 floors, and I'll get that exercise every day, okay? What I'm trying to say is, how many people do that? About 1 out of 1,000. So what I would say is examine your day. Look at your day. Take out a piece of paper, write every 30-minute increment. Say, can I get more exercise here? Can I get more exercise here? And quite often, you go to the store, park a little farther. Wherever you are at home, you have to go to the bathroom. You're in the basement, go to the upstairs floor to go to the bathroom. You're in the upstairs floor, go to the basement to go to the bathroom. Just do these little things and you'll get a lot stronger. You don't need to do a whole lot, but just work it into your day. You can have a little routine when you take a little study break, okay? Yeah. And you're going to notice too, most of the people that say the opposite of me, they're either selling a supplement or they have sponsors, okay? I still work full-time in clinical medicine. I used to do this as a hobby because I know it's right. I know it's good, okay? Versus you'll see a lot of these internet experts, they don't have to because they're getting all this big money sponsors. All right. So anyways, there it is.
All right. And then we had another question from Kerry, who says that my mother-in-law has had major bowel surgery a few years ago from diverticulitis and has been left with part of her bowel removed and an increase in potassium in the bloodstream, also known as hyperkalemia. Do you know if a reading of 5.5 would need urgent dietary restrictions of potassium, or just watch and see?
Well, 5.5 by itself is sort of like high normal. You start getting, usually they're asymptomatic, you know, even around 6, but you start getting up around 6.5 and then you worry about they could have an arrhythmia of the heart and even sudden death. So you would want to check it frequently in the beginning, get a sense of what their baseline is. You can also, to some extent, counteract the effect of potassium with sodium, because there are a bit of conflicting ions and electrolytes, you know, because there's something you go by to prevent hypertension. Usually you want to be eating about 5 times as much potassium as sodium to help prevent hypertension, really even 10 times as much potassium as sodium. I think my diet's probably about 20 times as much potassium as sodium. But she also wants to avoid kidney failure. But I would look at her diet, and you can look at things. For example, you got a picture of a beet right here on your thing. You can look at the beet juices, all right? There's different brands of beet juice, and some of them have 700 potassium and 100 on the sodium. Other ones will have 500 on the potassium and 200 on the sodium. So if somebody's having a problem with their potassium being too high, I would, in that particular case, usually I'm all about lowering sodium, but in her case, you know, maybe she needs a little more sodium relative to her potassium. And she should work with her doctor. And like I said, figure out where she's at. Is she holding steady at 5.5 or is she bouncing all over the place, 5 to 6.5 or something? You want to know that. And then again, you can go through your diet. And, you know, normally I think fruits are pretty good food, but fruits can be very high in potassium relative to sodium. She might want to reduce them. She might want to find plant-based foods that don't have as big of a differential between the amount of potassium and sodium.
Oh, very good. Thank you so much for that. Okay, I think we got caught up with the questions. I really want to thank you, Dr. Rogers, for coming back on the broadcast again. Dr. Rogers has been coming on almost as a monthly guest and exploring so many topics. And today's topic was very important and very inspiring to know that we can do something about taking care of our health, especially with kidney disease and kidney stones. And I really want to thank you for that. So what is your final take-home message for our Green Warriors?
Well, this just reinforces what I said before, this low-fat vegan diet. It's an incredible thing, because it basically means you're not inevitably screwed. And I think pretty much everyone else is, towards just progressive deterioration as they get older. We're all going to die eventually, but you want to have an expanded health span, be in pretty good shape until the time comes that you die. All right, whenever that might be. So with the low-fat, low-sodium vegan, you're most likely going to live longer, and you're most likely going to be mentally intact and physically intact until your time comes. And so why not get the most out of it? You only get one life. So, because also once you're cognitively slow, you're going to have less mental energy and learning capacity to turn things around. So you really want to prevent things to the extent you can. It's a lot easier to prevent the problem than it is to turn it around. So I find this a wonderful thing, and I wish I knew all this stuff before. I would have been able to, keep my mother alive an extra 10 years probably, and my father, I would have been able to keep him healthy another 15 years. I just didn't know. And like I said, none of the doctors know. I was as good a student as a student could be. It just isn't in any of the books. I can tell you, the conventional medical doctors, they don't know what they're talking about. All their books are a joke. I'm not just saying that, it's true. I rewrote the book. I wrote The Medical Reformation and Vegan Renaissance because I said they're completely stupid. Here's a typical medical book. It'll say, well, hypertension is mostly idiopathic, which means the doctor's an idiot and the patient's pathetic, of unknown cause in 95%. Therefore, we also call it essential hypertension. You might as well take our pill and try to slow it down. It does appear to be associated with aging, seems to be partly genetic. It might also be in part due to socioeconomic disparity. Isn't that thoughtful? It's a crock of BS, okay? If you look at 1929 paper, Donison is the author, Lancet Journal, blood pressure in the African native, 1,800 consecutive hospital admissions. What percentage of 1,800 consecutive admissions would be hypertensive in America? Probably be about 70% at least, okay? In Kenya, where they ate a plant-based diet, it was zero, okay? And that's the kind of differentials you see from the plant-based diet versus these high-fat, modern meat and processed food diets. 100 to 0. We're not talking about a close competition of 5-4, tie going to overtime. No, BS. We're talking about these low-fat plant-based patients. None of them are fat. None of them have hypertension. None of them have the autoimmune disease. None of them have type 2 diabetes. Their incidence of cancer is so low, it's a waste of time to screen for it, okay? Why wouldn't you want to do that? Trust me, that's the differential. This is hidden from the public because, think about it, society would all change if this was widely known. And I can also tell you, most patients, they're hopelessly lazy and curious and stupid. They won't change their diet no matter what. I have all these people, all these healthcare workers. I know a lot of healthcare workers, technologists, secretaries, doctors. They're like, well, I'm cutting down. I'm working on it. I maybe after the holidays, and they never do. Okay, I had a friend who's a neuroradiologist, nice guy. He went vegan for a little while. He lost 50 pounds. He's in great shape, and then he went back to his old habits. Had a big stroke. And that's pretty typical. So, you got a chance. Otherwise, you're screwed. And I always I had a pretty tough academic, lonely life. And I sort of wanted to become a great doctor. And it's kind of hard in regular medicine because they just want you to generate billing codes. No one gives a rat's tail about patients. Patients are just generic widgets, okay? You generate your billing codes. You can't be sued as long as you follow the standard of care. And it's kind of boring. There's no way to distinguish yourself. I have a great mind, okay? I wanted to use it for something, okay?
Well, so we're glad that you're here, and we're not kicking you out.
Well, thank you.
So, Green Warrior, tell us, what are you going to remember from today's broadcast? Wow, there is a lot of things to remember. For me, I love when my brain lights up, and this was the first time that I heard Dr. Rogers talk about meat eaters having. Well, I knew that meat eaters have a higher white blood count because my white blood count went down after I adopted this lifestyle. But I didn't know that the higher white blood count was another cause of hypertension. So that made my brain light up today, and I really appreciate that. And Green Warrior, go ahead and type in the comments what was one of your takeaways from today, because I like to put those there so that people who are scrolling along can see what we're talking about and maybe pique their interest to take a look. I also wanted to thank Jess Task Voice. She did the promos, she did the countdown, she makes my thumbnails. She makes my world a lot easier to get this information out to all of you. And Jess Task Voice, tell us who's coming up next.
Do you feel overwhelmed by stress or struggle to find inner calm? Have you explored how breathwork and EFT tapping could transform your emotional and physical health? Join us as Nikki Perkins shares actionable techniques to help you breathe your way to balance and peace. Wednesday, January 29th, 3 p.m. Eastern, noon Pacific, on Be Green with Amy Live.
Well, most of all, I want to thank you, Green Warrior, for joining us today, because your engagement and your support make these discussions meaningful and impactful. And I really hope you're feeling inspired to take a closer look at your food choices and make some positive changes for your health and well-being. And remember, every bite we take is an opportunity to nourish our bodies and, like Dr. Rogers, become the healthiest version of ourselves. And I would like to give Dr. Rogers a chance to talk about what he does and how we can find him.
Oh, I got a YouTube channel, Peter Rogers MD. I got videos over there. I've also written a lot of books, and they're at Amazon.com. Probably my most comprehensive medical book will be the Medical Reformation, where I rewrote the internal medicine textbooks. They're all stupid. They need to be rewritten. I wrote a book recently called Food, Moon, and IQ. I basically rewrote much of the psychology, psychiatry, neurology textbooks because they're also totally stupid. They're a disgrace. They're so bad. And I write a lot. I've written a lot about study skills. I was interested in study skills. I was first in my class, all that kind of stuff. And I really studied study skills. So anyways, those are some things you might like. If you go to my YouTube channel, the best thing you'll find is the playlists, because then there's no reruns or repeats, and you can study an individual disease like, high blood pressure or diabetes or whatever it is that you're interested in, atherosclerosis, for example, that sort of thing. That's about it.
Yeah, we work hard on those playlists, Green Warriors, because we want to make the information more accessible to you. And speaking of playlists, I created a playlist just with Dr. Rogers' lectures that when he came on Be Green with Amy Live. So you can always go there and see them too, and also visit his channel. So there's just a lot of places to get more Peter Rogers if you want to. And I also wanted to really invite you to stay tuned for more empowering content. Please subscribe to my channel. Check out Dr. Rogers' channel and as well, and share our message with others who you think can benefit, because together as Green Warriors, we can make a meaningful difference in the world. And as a special thank you to all of you, I'm offering you all 5 free recipes. So if you go to my website, begreenwithamy.com/join, I will send you recipes, just a few of them, just 5, and you'll get some more information about things that I like to do and things that I like to recommend for you to help you along with your plant-based journey. So I wanted to also, let's just see what else so what we're going to do now is I'm going to invite you, if you would like to type this in the comments. And as you're doing this, this is my tagline. And Dr. Rogers is going to join me with the last word. So until I see all of you again, remember, be strong, be well, and be green. Thank you so much, Dr. Rogers. Thank you, Green Warriors, for joining us again. And Dr. Rogers will be a monthly guest, so please come on back and join us.
Looking for really tasty recipes that are SOS-free? No sugar, oil, or salt. How can it taste good? Well, if you like flavor, then you'll love this Be Green with Amy recipe ebook. Get your copy today. Click on the link in the show notes. Be strong,